Hello, Austin. Madeline here. So excited today to introduce you to Sadie, who is an amazing licensed acupuncturist here in Austin. Welcome, Sadie. Thank you so much for taking time.
Thank you for having me.
Yeah, super excited to hear your story and get that shared with our people. And so just start out, what sent you into the healing arts and sent you on this journey to become a healer and practitioner?
Yeah, sure. So first I wanted to thank you for the work you're doing in connecting patients and people to their support networks. That's really wonderful. And I couldn't be happier that people like you are doing this work. Thank you. And what started me on this journey was well, both of my parents are medical professionals, and in my family, what was valued was service and helping other people. So I think that that was instilled in me, but it also is a bit organic in just who I am. It's really truly like in my DNA to
Mhm.
help, and so that's one part of it. My mother was an OBGYN nurse practitioner, and so I went to my first birth when I was 12, and she really was a big influence in me thinking about reproductive health, like that. And then I actually have a stepmother and a mother.
Oh,
So my stepmother, when I was 13, she, not to get too personal, but she had a stillbirth, and
see.
that had a huge impact on me as well. So there were all of these different influences in my life leading me to do the work I do today. I
Mhm.
did actually set out to do this when I went to acupuncture school 18 years ago. Um, I just went to school thinking this is fantastic work. And as I started to get into the world and into practice, I more and more became excited by how powerful this medicine is for impacting fertility, preconception, pregnancy, postpartum support. And really acupuncture shines in that light. We're really, really good at pain management,
Mm.
really good at balancing the endocrine system. So for all of those reasons, that's the one I chose, the path I chose. And so that's really my area.
That's so cool. And so you work primarily then with women who wants to get pregnant or having difficulties. And so tell me a little bit about your ideal patient. Is it somebody who's been trying for a while or done a bunch of other stuff, or do they tend to come to you right away?
That's such a good question because I love the patient who's preparing their body and really forward thinking and just wants to be healthy, and on point and educated. And that's fantastic. Most of my patients are not that person. They've been struggling for a while. It's just not happening, or they've already been in touch with their OBGYN or their reproductive endocrinologist. And so they're really in the thick of challenges is really the bulk of what we see in our practice. And then we take them through their pregnancy. And I see a lot of people that are already pregnant, and then through the birthing process. Yeah, and I can tell you all about how we do that as well.
Yeah, I'm super curious to just hear a little bit more like what is your success rate? I mean, if somebody's gone through all of those different things, I know many women just that's like one of the hardest things that they're having to face, not being able to do something they dreamed about their whole life to be a mother. And men too want to be a father. And so how, right? It's such a, I think, really vulnerable and painful and so much grief around it. A lot of people go through miscarriages and like you talked about stillbirth and then it's something that nobody talks about too, right? There's a big lid on it, on top of everything else. And so, what is your success rate working with these women?
Yeah, you're hitting on so many good points. And I do have to say that my perfect patient is not necessarily female. We
Mhm.
see a lot of male factor as well. And for unexplained infertility, it's not often viewed as potentially the man's issue, because we really can't find anything there. And half the DNA is from the male. And statistically, you know, 50% of issues are male factor infertility. So it is important that everybody, the team is all on board and that we're really addressing the health of everyone. So that's important. And then, so our success rates are higher than average. And that's considering that our patient population are the people that are really struggling. They're not just the regular run-of-the-mill people, you know. We also work in a very integrated way. So we have 2 locations in Austin, and our South location is inside the Texas Fertility Center. So we work very closely with really all of the reproductive endocrinologists here in town. And I really think that that's the best approach, is to utilize all of your resources, you know, especially in family building, which is so intimate and so personal and so private, like you said. You know, usually when we're going through some grieving process, you know, our friends bring us casseroles and cards, and you know, we're really expected to sort of get up and keep going. And this is quite the roller coaster.
Yeah.
So yeah, I mean, every cycle is a loss, let alone when somebody has something like a miscarriage. So, you know, I really feel that a huge part of my work, in addition to increasing circulation, getting hormones to their target sites, supporting the immune system, which more and more Western medicine is recognizing as a contributing factor to infertility, and calming the nervous system. And so a really, really important aspect of what we do at Sage is supporting women holistically, and that includes their emotional health and well-being. So we strive to create a really beautiful container, a beautiful space. We have a large office, and people come in and they can immediately feel taken care of, and that this is a safe place for them to not only get the medical side of things, but they get the support in that we know what we're talking about. We know all aspects. We know the Eastern modalities. We know the Western medicine. We know what, you know, medications they're on. We know the doses. We know the procedures. We can guide them through that process and answer any questions they may have, as well as explaining our medicine to them. And then we create a space where they can really be heard, you know.
Yeah, it's so important.
It's
yeah, service. I mean, this is why I love holistic health practitioners the most. Because I don't know anybody else. I call you guys healthcare heroes, because in my mind, you guys are total heroes, because you really just show up for people in such an amazing way. And, you know, healthcare is such a minefield for most patients. And to have that level of a spokesperson who really understand the process, the emotional aspect of it, and really know the struggle and can guide you through it, that's just, it's priceless to have somebody like that by your side. So amazing work. So excited. And how long does it on average take for somebody when they first start working with you? And at what point do you say, okay, you know, maybe this is not the magic thing that's actually going to make this happen for you?
Yeah. So the magic is really interesting because it happens at all different phases. I saw a woman today who ended up adopting because she couldn't, I mean, she tried everything, you know, failed donor egg cycles, and multiple ones. And she is now pregnant with her 2nd natural pregnancy. So it's, you know, so the magic really, and that is magical. You know, we can't necessarily rely on those exceptional cases, but more than not, I mean, really all day in my practice, I see things happen that clinically shouldn't be happening. Yeah. So what was your original question?
I just said, how long does it usually take? So when somebody comes and see you, like how long should I invest in that process? And at what point do you throw in the towel and say, okay, maybe I should test something else out?
Right. So let's start with the time frame of when you should be seeking help. Yeah. So if you're just like, you know what, I have an idea, I want to get my body ready, or even if you're like, you know what, my cycles are a little off, I know, I'm curious what needs to happen. So you come in and get an assessment, and we're going to actually create a plan for you. And that could involve talking to your doctor and saying, we need these base foundational fertility lab work so that we know what we're looking at, you know? And so generally speaking, that happens based on your age. So, and this is just what the medical data shows us, is that if you're 35 years old or younger, you should have tried for a year of every cycle trying to conceive before there's really a problem. Yeah. And then if you're over 35, you need to wait 6 months only before you would think, oh, you know what, let's do some investigating and see what could be going on here. And then based on that, if there are real red flags, then we'll counsel you through the pros and cons of at what rate you want to escalate into more aggressive treatments. But always the foundation is that we're supporting you endogenously inside your body and what your system can do on its own. And then if it's necessary to add something externally, external medication or procedures or investigations and diagnostics, then we will talk you through that process. But as we were saying, you know, I'll tell you that it takes just biologically 3 to 4 months for an egg to mature. So what that means is that every woman is born with all of the eggs she will ever have, but they're dormant until puberty, right? So they're really in hibernation, we could say. And then once one is being recruited to ovulate that cycle, it starts to come out of that hibernation and respond to all of the different hormones going through the bloodstream and saying, okay, it's time to wake up and grow now. Yeah. So once that process starts, it takes 3 to 4 months for that full maturation before that follicle is going to be chosen to ovulate, that cycle. So if we have that amount of prep time to ensure hormonal communication, proper growth, taking away waste from the ovaries, then we have a better chance of supporting a healthy growth process, and that chromosomal abnormalities are less likely to happen. Yeah, and so so that's what is desirable on one hand, that prep time. And some people don't have that prep time. They're already, you know, in the middle of their IVF, let's say, you know. So in that case, we're not necessarily focused on, or they're about to do an embryo transfer. And all this might be too much information for some people, but some people are going to be, oh yes, this is exactly where I am. And I know the language you're speaking. So those people, we're going to focus on increasing circulation, oxygenating the blood, making the uterine lining really receptive and rich, calming the immune system. So wherever people are in their process, we can create a healthy host and a healthy system that's going to support fertility. Yeah.
Fantastic. I mean, it sounds like you offer and support for people. Am I breaking up?
A little bit. Yeah, just a little
bit. Here, it's sounding on my end like I'm talking underwater, so I'm sorry about that. I hope I come back. Internet. Yeah, but just a wealth of knowledge, and what amazing value that you guys provide. And thank you for explaining it so much in depth. I think it's really helpful for people to understand the process. I mean, if somebody's in the throes of this process, I'm sure they understand the different parts discussed and are well aware, and so they can see themselves where they can kind of step in and work with you. And so you have a really sweet offer. So when people want to find you, what is the best way to get in touch with you and find out more, and what can I expect from their first visit?
Sure. So our website is a great place to start, which is reproductiveacupuncture.com. And we also on there offer free consultations so that you can talk to me about what's going on specifically with you and what your interests are as far as your health and your process. And then what to expect is that we set aside a lot of time. Like I said, we really prioritize people's well-being overall. So we spend a lot of time with people discussing where they are and what's going on. So the initial consult is an hour and a half. You actually get an acupuncture treatment that visit as well, but we're going to really go through the different systems in your body, how your digestion is, how your sleep is, what your cycles look like, what your reproductive history is, and create a plan together. So we give a lot of time to answer questions and put you on the right track. And then you get a treatment that day, and you leave knowing, having real ground under your feet about where you're headed.
Awesome. Beautiful. Yeah. Tell us about the offer, and I'm going to put it up here and just to show it to everybody. And then why don't you talk a little bit about it? What this
Right. So we just appreciate what you're doing so much. And anyone who mentions this video, we're offering $20 off of the initial visit.
Beautiful. Perfect. Yeah. Thank you so much, Sadie. I really appreciate you being here so much, and the work you do is amazing. Thank you for showing up that way in the world.
Pleasure. Thank you.
Cool. Thank you, Austin. We're going to sign off for today.